Why do you have a lot of acne? You're gaining weight too. What happened?
How can they be so cruel? Don't they know anything about my condition?
Good morning, grade 11. Hello, our topic for today is PCOS. What is PCOS? Does any one of you know what PCOS stands for?
PCOS stands for Polycystic Ovary Syndrome.
That's correct, and we're going to know about it further by watching a video.
Condition: Polycystic ovary syndrome, PCOS, is a common hormonal disorder that affects women of reproductive age, affecting the gonads glands, the ovaries. Imagine a stress ball, but instead of being filled with squishy material, it's filled with tiny bouncy balls. These balls represent the eggs in your ovaries. In a healthy ovary, these balls are released smoothly, one at a time, like squeezing a stress ball and having a single ball pop out. This is how ovulation works, allowing for a chance to get pregnant. But in PCOS, it's like the stress ball is stuck. The tiny balls inside are bunched up, not releasing properly. This is because hormones are out of balance, like the stress ball having too much air pumped into it. Causes.
The exact causes of PCOS is unknown, but there's factors that might play a role include heredity. Research suggests that certain genes might be linked to PCOS. Having a family history of PCOS may play a role in developing the condition. Excess androgen. With PCOS, the ovaries may produce high levels of androgen. Having too much androgen interferes with ovulation. This means that eggs don't develop on a regular basis and aren't released from the follicles where they develop.
Insulin resistance. Many women with PCOS experience insulin resistance, a condition where the body's cells don't respond properly to insulin, leading to higher blood sugar levels. Insulin resistance can contribute to increased androgen production and worsen PCOS symptoms. Environmental factors. While not fully understood, environmental factors like exposure to certain chemicals or pollutants may play a role in PCOS development. Signs and symptoms. The most common signs and symptoms of PCOS includes abnormal hair growth, excess facial hair or heavy hair growth on your arms, chest, and abdomen. Thinning hair, lose patches of on their head or start to bald. Acne, found in your back, chest, and face that may continue past your teenage years and difficult to treat. Obesity, have a trouble maintaining a healthy weight. Irregular periods, missing periods, or not having a period. Heavy bleeding during periods also may occur. Darkening of the skin. Patches of dark skin, especially in the folds of your neck, armpits, groin, and under your breasts. Diagnostic methods. There is no single definitive test for PCOS. Diagnosis typically involves a combination of medical history and physical exam. Your doctor will ask about your menstrual history, symptoms, and family history of PCOS. They will also perform a physical exam to check for signs of excess androgen, such as acne or hair growth. Pelvic exam. This exam helps assess the size and shape of your uterus and ovaries. Hormone tests, ultrasound scan, and other tests. Treatments and management strategies. Does PCOS have a permanent cure? There is no permanent cure for PCOS. There are treatments that can help you manage your symptoms. Treatments include both medication, lifestyle change. Treatments for women who have no plan of getting pregnant. Hormonal birth control helps to regulate your menstrual cycle. Some forms will also improve acne and help with excess hair growth. Medications to block androgens control acne or hair growth. Treatments for those who have plan of getting pregnant. Drugs to induce ovulation. Certain drugs have been proven to induce ovulation in people with PCOS. Surgery. Surgical procedure can help restore ovulation by removing tissue in your ovaries that produces androgen hormones. Impacts on quality of life. PCOS can significantly impact a woman's quality of life in various ways. Physical health. PCOS increases the risk of developing long-term health problems like type 2 diabetes, heart disease, sleep apnea, and endometrial cancer. Mental health. The physical and emotional challenges of PCOS can lead to depression, anxiety, and low self-esteem. Myths or misconceptions. Myth number 1. People with PCOS can't get pregnant.
Fact: having PCOS does not mean you can't get pregnant. PCOS is a common cause of female infertility, but it is treatable. Many people with PCOS can get pregnant naturally, especially with lifestyle adjustments.
Myth number 2. Infertility is the only medical concern associated with PCOS.
Fact. In addition to infertility, PCOS can cause a wide range of issues due to hormonal imbalances. Some of these include insulin resistance, weight management, hair loss, abnormal hair growth, and acne.
Let's break the silence and build a supportive community for those living with PCOS. Share this video and let's work together to raise awareness.